Welcome, everybody. And I'm Jose Garcia. I'm one of your hosts. I'm not the only host. Antonia, do you want to introduce yourself?
Oh, yes, of course. Hi, everyone. So I'm Antonia Abraham, and I'm the second host, the co-host, the sub-host to Jose. And
You're not a
welcome
sub-host,
to
you
this.
are a host. We're on the same level.
Yeah.
And do you want to give us, do you want to tell us a little bit about your experience before we start? We still have people coming in, so we're going to give them a bit of time.
Sure. Hi, everyone. Hi, everyone's AI note takers. I can see we have a lot of AI folks here. That's awesome. My name is Antonia Abraham. I'm a co-host, yay. And I'm a healthcare worker in Nigeria who's also very passionate about digital health as it pertains to advancements in terms of innovation and technology, and particularly how we as Africans can make African technology in healthcare for Africans. So it's amazing to be in this webinar whose directive is supposed to speak about investments and development, co-development in Africa. And we're going to be having a multitude of amazing hosts that are not just going to share their experience, but also able to establish what it means to invest, how to invest, and where the investment should go to for Africans. Because there's always going to be difference when it comes to the global West perspective and our perspective. So welcome everyone as we're trickling in. Feel free to drop your notes, messages, questions in the chat box. The speakers are going to make excellent use of their time, so they'll always have something to say in response. And we also have a party after, so you can be able to directly mingle with the guests that you find most interesting.
Oh, we got a live mic. There. Well, it's time to bring on our first speaker. And Elvis, are you here? See, I can't see him.
Yes.
I'm going to.
Yes, thank you, Jose. Because of my network, I will
you don't have to
put on.
Don't worry, you can speak.
Yeah. Okay.
Oh,
so
the theme is investment and co-development in Africa.
Yeah. Thank you very much, Jose and Antonio. Yeah, this is a fantastic platform to discuss matters Africa. I'm a health information expert and a clinical researcher. I will talk about a little bit of what Digital Health Africa is all about and in terms of investment. And basically, in the continent where access to healthcare remains uneven and the systems are often overstretched, and a quiet revolution needs to be done. And this is Digital Health Africa. It is not just a response to inefficiencies that are actually audacious in a leap into the future where technology redefines care delivery, data drives decision, and the innovation becomes inclusive, but it's actually for developers, scientists, investors, and alike to know that Africa is no longer just a beneficiary of global health breakthroughs, but is actually an origin point for scalable, sustainable solutions for the future. So for me, the case for Digital Health Africa is actually where we are looking at the first to bring up homegrown solutions to the inefficiencies that are there in Africa. So Africa health systems face chronic underfunding, shortages of medical personnel, and limited physical infrastructure. But it is a paradox that the continent enjoys one of the world's highest rates of mobile connectivity growth, with almost over 650 million mobile phones users and expanding 4G and 5G networks. So Africa is poised actually to skip legacy healthcare models and embrace this digital fast care ecosystem. So it is actually my play to anybody who wants to invest in Africa to look Africa with another third eye, not just from what we've been told from earlier on. But this is a continent that is ripe for investment. So for me, I see Africa as the only destination for investment currently.
Yeah. You're gonna go? Join in, Auntie?
See, we have
Oh my.
someone who needs to be muted.
Sorry about that. Go on, Elvis.
Yeah, people.
Oh no.
Oh, I muted Elvis.
Um,
That's not good.
Okay.
Yeah, sorry about that, Elvis.
The whole time you are not, I was not being correct.
We just lost you for a couple of seconds.
Okay. So I was saying actually Africa, as I said, is ripe for investment in terms of a digital health infrastructure. The only thing that has been happening in the continent of Africa is that we always have been relying on foreign data that is not propelling Africa in the right way. So across Africa right now, digital health is actually unlocking rich data sets and is enabling epidemiological insights and enhancing health systems performance. AI-powered diagnostics can actually change the healthcare infrastructure completely. And this is where we want investment to focus on. We have to focus on areas that are going to revolutionize Africa. You look at systems that are currently in Africa, the gaps that are existing is purely infrastructure and funding. But if you look at Africa with a third eye, despite all these shortfalls, Africa is ripe for investment. So for me, is to urge everybody to look at the resource levels that are in Africa, which is the youth that are digi-savvy and are ready to transform the current trends in terms of global healthcare. I rest my case for now as I invite everybody to look Africa with another perspective, not just from the perspective of being aid oriented. No, we are actually innovators in essence.
Yeah.
Thank you.
Thank you, Elvis.
Thank you, Elvis. That was such a brilliant take on how Africa in itself can focus investments for itself than on Western data. So thank you so much, Elvis. Really brilliant.
You're welcome. Thank you.
I think Africa has a youthful population, and right now it's like a lot of people might think, oh, it's not. I mean, it looks like that big a deal, but there's a lot of countries where the average age is going into the 50s.
Yeah.
Yeah.
And what happens in 10 years when the average age goes into the 60s? But that's what's going to happen in some countries, not all countries. And you know, but there's a thing is like there are African fintech unicorns, but there hasn't yet been an African health tech unicorn. What needs to happen? Is that something that should happen or needs to happen, or is that not something that people care about?
Yeah. What needs to happen in Africa is actually currently the capacity building that is lacking. The youth that are there are able to transform the healthcare sector in terms of digital health. But what is lacking actually the capacity building to bring all these people to tell them this is what you can do. And the funding has been lacking over time. And you find fragmented systems that are not actually pegged on a sustainable solution, but is fragmented. Everybody for himself, God for us all.
Yeah.
That is a mistake. If we bring in the private sector and the public sector together so that the youth, which is a resource to the continent, can transform what we talk about every day here. They are the revolutionary that we need to transform any infrastructure in terms of healthcare. And you look at even when you talk about research per se, because this innovation and investment must come up with an aspect of research, and you use the youth to carry out this research. How do you carry out research if they are not funded? How do you carry out research if you don't bring them together? How do you carry out research when we have fragmented systems? So all these logistical problems has to be addressed before you can venture into the next phase, which is revolutionary. And what we see in Africa currently is actually a breed of young techs who are ready to change the dynamics, because we have been having what we call the status quo. The status quo have been the people who have been there. They don't want to give space to these young people. But currently, there is a strong force, a movement that is transforming and sweeping across Africa, which is actually scientific innovation, and the youth which have the power to transform what we talk about every day is actually the next phase of investment. So invest in the youth and make them be powered, empower them to transform the continent's wealth into what can now be seen globally. Because currently the wealth is going somewhere else. We do have investment, but it's just Africa as a conveyor belt. Now we have a chance not to use Africa as a conveyor belt. Actually, innovation has to be here. I remember in the last previous webinars, we talked about Africa owning the data and Africa having their technology. I talked about the Chinese having DeepSeek. We're gonna have African DeepSeek. And AI Africa, digital Africa is it is actually a goal that cannot wait anymore. We have to score that goal, and that will happen.
We can make focus that on the next webinar. I'm already planning the next webinar. Thank you so much, Elvis. We're not getting rid of Elvis. We're not getting rid of Elvis. He's going to come back towards the end, and he's also going to be available to answer your questions in the after party.
Okay.
Thank you so much, Elvis.
Thank you.
Now, our second speaker, Joseph, he was the first digital health founder from Africa. I met him around this time last year. It was actually talking to him that we had the idea for this series. I didn't really know what I said. Hey, let's do it. And then I didn't know what I was doing, but we started. And then I'm going to bring him on. There.
Hello, everyone. My name is Joseph. Thank you very much, Jose, for that very warm introduction. Just to clarify, actually, most of it was Jose's idea. Me, I just did the pushing and probing. When is this happening? When is this happening? Because I was very curious to find other digital health founders in the African continent. My name is Joseph Katimbo. I'm the founder of Serene Mind. We are building Africa's mental health infrastructure. We have started with a digital platform that connects people to mental health. Our goal is to provide mental health services without borders. And at the moment, we have 50 therapists on the platform with a capacity of about, that can provide services in 10 different local languages from Africa, in particular Uganda, and some other East African languages. Jose invited me to talk about co-development, why it is important to develop with the target markets. Fortunately, at Serene Mind, the first 6 months were just running around. But then as I got to talk to more people and understand about the situation of mental health, why people shun away when I start talking about mental health, I found a gold mine and found when you talk to people and try to understand, try to get them on board with you with what you're building, you end up discovering a lot more than you expected. Because in Africa and anywhere else, it's not just the access, it's the relevance and trust. So if people feel like you're relevant to, for example, for the African continent, you're relevant providing services in their language, you're relevant promoting mental health in a way they understand, that talks about the current stigma, the cultures, how you can incorporate this, why it's important, what happens if we don't deal with this issue, etc. They then get a different picture, just like you get a picture of working with them. So many times you find that we build solutions from, I'm an engineer by profession. Most of the times we just come with this approach of, okay, I think we can fix this, this, and this. No, that's not how it works. You can do it that way, but it will take you much longer. However, if you build, for example, for us with the patients and the specialists themselves and the institutions, you find a lot of small things that may look insignificant, but over time, over the years, they compound and has helped us build the platform Serene Mind we have today. Yeah.
You know what? I think you were one of the first 2 founders last year who
Yeah.
took
Yeah.
And one thing I keep hearing is that it saves money.
Yes.
And can you explain why?
So I'll keep talking about Serene Mind. Maybe I'm plugging it in, yes, but it's the best example I have. For Serene Mind, we had started with a mobile app, normal mobile app where you can access a therapist, etc. But we had spent about 8 months of development and costs. But we realized people were sharing the platform. They were not interested, especially the therapists. So we went to the therapist and asked them, you don't seem to like this platform. Why? What are the challenges? What could you change? We ended up rewriting the whole program, starting afresh, which is why we changed to a web app, because one web app, they're able to access it from their desktop and computer. They since most of the people giving the therapy are an older generation, they are much more tech savvy with computers than phones, and they complain everything on the phones is in small fonts. I don't know where to find it, etc. So many other things. But with their computers, one, they can easily see their clients. Two, they have used their computer a lot. Even typing becomes faster. So they end up having something, improving their practice, but also adapting them and finding them where they are. Secondly, it also meant, yes, okay, we want to encourage therapists to provide services online, but without working with them, again, we had made the same mistake. We were saying, okay, this is how we're going to do it. And we found customers were complaining, the therapies, they don't feel it's effective, it's a waste of time, etc. So at first I thought it was maybe the quality of the therapists, but I went through with them and we found the challenge was us again. We hadn't worked with therapists to ensure that, yes, now therapy is digital, but how do we ensure that it's still effective? How do we ensure that maybe a form that is filled in at the start of the therapy session is taken into account when they are going ahead? How do we do the feedback? How do we do the follow-up? How do we address a group when we're doing online? All of those things we had to learn. And yes, some parts we went big-headed and reverted to engineering thinking, and we lost a lot of money, but it's a lesson to learn. Yeah.
This thing I keep on hearing is that I think the traditional way is you build an MVP.
Yes.
And then you go to the users.
Yes.
And then you find out that, oh, we have to change it.
Yes.
And I think also people make, and I know it's more so in digital health.
Yeah.
That as opposed to a direct-to-consumer application.
Yeah.
That people get surprised a lot.
Yeah.
Antonia, do you have anything you want to add?
Yes.
Yeah. Well, personally, I'm more phone savvy than laptop savvy. I relate to why there was a change in preference and having to alter the code to that. I think it's very interesting to point out how for Africans, innovation will always look. I'm sure that you was in African days, because I'm sure even my friends are more inclined to perhaps inspire being young people. But I think that's because the culture we have down here is more to accessibility of the internet forms than the West. So I think it's a brilliant example on how it looks different for Africans when it's for Africans.
What advice do you have, Joseph, to people who want to build a community in their development and include them early in the development process?
Maybe I can talk about it from an investment perspective, since we're also talking about investment. So when you build with a community, you're not guessing. You're not guessing clients. You're not guessing, oh, if I build Serene Mind, people will be knocking at my door and pay however much you're charging. No, no. You're actually working alongside the users. Now, the challenge is you have to find the first 5-10 users, because of course, all of them have different things you learn from them. But whatever you're doing in development is backed by real data, real people, and real feedback. This becomes very important when you have reached how would you call it? You've reached a wall and you want to understand, what did we do wrong? How do we go back and fix this? Since there's all this feedback and real data, it's most likely documented. So it's easier for you to go back and see, this is where we failed. This is where we went off the rails. That's how I know that this is where we went back to engineering thinking. And it also enables the people you're working with to see themselves as, for example, the case of Serene Mind again, co-architects of Africa's next mental health infrastructure. They have a sort of passion for it because they understand, they see maybe could be something simple as a button. And they say, oh, I'll keep using Serene Mind because when I said, why do we do this, this, and this? How about if there's a button to take me straight if I need to talk to a therapist urgently? How about I can press it and there's someone online, even if it's whatever time of the night? So they feel like they have a say and they are part of a community that understands them, which means if Jose was the one that talked about this button, he's likely to show Antonia and say, there's even a button you can use to access help when you need it. There's even this, and that. So you find that you go from having just a community you're consulting to build a platform to having basically mini salespeople that are selling the platform for you, and you get a lot of feedback, which puts you, I would say, light years ahead. And even when you go to investors, you really know what you're talking about because you have the data to back it up. You have the data to, for example, like as you've said, sometimes someone could say, why didn't you do this? And you say, we didn't do that because we tried this and this didn't work. So yeah, I think building with your community is a much better approach and saves a lot of time, gives valuable feedback, and the process is much more entertaining. Yeah.
Let joy be your compass.
Yes.
Thank you, Joseph. We're bringing Joseph back.
Thank you, Jose.
And now for our next speaker, Collins. Are you ready? And I'm bringing you on. Welcome.
Hi, Joss. Hi, Jose.
Thank you. Thanks for coming. And now this is the part of the webinar where we talk about bad news, challenges. Colin's going to talk to us about a bunch of things. One of the things he's going to talk about is challenges under the premise. Do you want to introduce yourself, Collins, before we get into it?
Absolutely, absolutely. So, hi, my name is Collins. I'm a tech entrepreneur, founder, and an advocate for solutions that doesn't just look good on pitch decks, but also they actually do the real work for the people in the ground. Uh, that's basically me. I've worked with across many sectors. That's with hospitals in Kenya and East Africa, youth innovators, NGOs, telemedicine. Uh, I've been with Jungo Farm as well, advocating for pharmaceutical, empowerment and supporting, digital health in that sector where people will source medicine and get medicine on time, affordable rates, and whatnot. If we're talking about digital health in Africa, I think we must be talking about building together, not just investing, but also co-developing solutions rooted in the realities of our continent. Thank you so much.
Thank you. You can keep talking. We've got you on for another 10 minutes, 7 minutes.
Yeah, absolutely. So I think one of the things personally I have come to really appreciate is the need to build solutions that are solving African problem and for the African people. And this is where you tailor make all your solutions. And via doing this, I think we are putting Africa at a greater height where we are not only competing with Asia, Europe, and US and whatnot. So out of the very personal experiences I've had, and out of the small experience in the telemedicine aspect too, one of the things I've come to really appreciate is what needs to be done. Is it just building? Who is investing? Are even Africans investing in what they are doing? Is there an appreciation on what we are doing? And so, what are the challenges we are having as Africans in the telemedicine? Mr. Joseph, I like the approach he used where he said they were building with the community. You just don't want to go and bootstrap a Silicon Valley idea and just come and say, hey guys, I'm going to make you a telemedicine. This is digital health now. We're going to press buttons. We're going to get doctors. How does it look like the situation? I mean, out of myself, I think now this is the place where I say I deserve maybe an Oscar or maybe an award, maybe because of traveling up to 38 counties in Africa, meeting patients, meeting doctors, doing advocacy, doing the real work on the ground. I'm rarely in offices. I'm there meeting the consumers of these digital solutions we are creating. And so that leads me to what needs to be done, starting with local voices. Co-developments means working with health workers, hospital admins, community leaders, and patients. And in the designing moments, we work together with them. Also, to number two, I think funding context-driven innovation. This is where even African investors and any other investors, they don't look at this in a view. Investing in ideas that are made out of context, platforms that need also to work offline, respecting the culture, the norms, solving logical logistics, delivery, reporting, whatnot. Again, talk of leveraging with NGOs and hospital networks and any other advocacy or patient care network. Last week, I was in a conference where we were talking about Digital Health Africa, but in a different context, where we were talking about how it was NCDAC, Non-Communicable Disease Alliance of Kenya. How do they source medicine? Where do they get? What technologies are they using? This is a group of patients who have come and they've said, hey, this is our problem and we want the tech, these are older generations too and younger generations. We want solution. Does it mean to do infrastructure first? Does it mean to invest before just building flash techs? Let's build the rails, electronic records, connectivity, local supplies. Africa is very connected, like you said, and it's very true. People have smartphones, but access to doctors is really hard. In my country, people are even protesting because of very poor medical access. What needs to be done? And so when we have this kind of conversation, does it mean we invest in young talents, or does it mean we create platforms that won't fall down? Is it that we are really lacking funds? This is the conversation that Africa needs. And so I think to really just sum it up and to have the key context out of, what I'm speaking about would be what needs to be done. We need to have local voices. Let's co-designs with health workers, communities, and all these people we are with together. We need to find a way to appreciate these young startups and not just the big, startups here in Africa who have already done and they are solving. We need to go back to this context-driven innovation. What are you solving? Hey, you know what? I'm solving something on dementia. I've been with organizations like Women for Dementia, working with Dr. Tasneem. She's doing care work for the elderly, and just sitting down to design talk of a telemedicine that would help these individuals. The other time I was in Muranga County where we were working with CHPs. Those are community health providers under the UHC. And I was looking at the whole work that's being done, being there to support, organizing the logistics, planning all these things so that all this happens. And in that context, if Africa is being given an opportunity, to develop in terms of innovation, we really need to go to the grassroots. Really need to go and do the work. It's not creating pitch decks that are gonna shine out there in Silicon Valley or whatever startup hub you are, but it's building what is there. I mean, I want to give a good example of Jungo Farm. They just released the consumer app. People are pharmacy hopping. People are moving from one pharmacy to the next, trying to look for medicine. Who is investing in such solutions like Jungo Farm, who are coming to help people be able to get it. Talk of even my own startup, Mimi AI. We are making memes to help you get access to, mental health. Talk of sourcing medicines. Be very wary of, how you use your medicine and whatnot. And so I think if even as we invest in young talents, we need to have more VC coming to Africa, doing more work, getting more African investors to come and invest with us and work with us and be able to see, oh, these guys are building something, and that's what we look forward to building. I think this is one of those things that Africa really needs, and also particularly even in Kenya, we are seeing a lot of these East Africa, West Africa, North and South, name it. We are really seeing a lot of new tech startups coming. We need to create an ecosystem on what are you solving, how can we build it better, how can we do it together, not everyone in silos. And that would really, really help when it comes to African development for sure. Yeah. So I think you have any comment on anything like that, I would be very much open to have that chat. So if it means to do a call to actions, let the investor start fund grassroots, not just flashy urban tech. We don't want everyone to be in Silicon Valley. Let the policymakers be able to enable experimentations and also help them scale. If it's health workers, let's work together collaboratively. And I think out of saying that, it's very easy to conclude my statements by saying Africa doesn't need digital health that looks nice in Silicon Valley slides. We need systems that have or we save lives in Mombasa, West Africa, East Africa, North and South. And that's one of the things I'm always really enjoying to see solutions for African peoples and solutions for everyone at large. I think that's my take on what needs to be done and what I've seen on the ground. I am a grounds person a lot. I am rarely in offices. I'm always there solving and bringing rain when it's all shining there.
Thank you, Collins. And we're going to bring Collins back at the end of the event and for the after party. Thank you so much for sharing that with us. We have our next speaker, and Samuel, are you ready? Are you ready, Samuel? I'm putting you on the spotlight. Hello.
Thank you so much.
Thank you, Samuel. And you have a very passionate delivery in a previous webinar. And I know when I watched the replay, and Tonya, you were clapping your hands. I don't know if you remember that. And I wonder if you could, before you start, Sammy, do you mind introducing yourself? There might be some people who don't know you.
All right, thank you so very much, Jos, and our co-host for the platform and the privilege given to me and my co-speakers once again to bring to the table how we can cooperate in order to develop Digital Health Africa. I cannot thank you enough. My name is Samuel Daniel. A lot of things happened when I was born. That was why my parents gave me the name. And while growing up, I had so much challenges health-wise. That's why I do multiple things, because multiple things happen in my life while growing. A lot of people keep asking me this question. Why are you doing what you are doing? Why are you into digital health? You see, while growing up, I discovered I was knocked down by multiple diseases. They say the first one was ulcerative colitis, the second one, chronic eczema, and pile. Then the last one in 2012 almost took my life. And that particular ailment mimicked hepatitis B. But I went to the hospital. There is no diagnosing that they didn't do, but it proved abortive. Medical science couldn't give the exact solution. They couldn't diagnose what really happens to me. So I was carrying all these multiple sicknesses around. All I needed to do was to research to myself. Since medical science couldn't give me the solution, I resorted to my faith in God, and I went into research, intensive research, to bring solution to my personal problem. And at the end of the day, and of course, if you look at me, you will agree with me that I am very sound, health and heart. There is nothing wrong with me. And so I am into digital health because I found a solution to my health issues. And that is what I love doing right now. All right, back to what we are having at hand. Digital Health Africa, investment and co-development. I want to seize this opportunity to appreciate my co-speakers for a job well done. I wish I can speak like Joseph. I wish I can speak like Elvis. I don't need to talk like them because I am burning right inside of me, because a lot of things are going on in Africa. And though they say Rome wasn't built in a day, so I don't expect all these things that are happening in Africa to be solved in a day. But I know as we progress, things will get done in Africa. I am looking at beyond pilot, building digital health systems that last. A lot of projects have been coming into Africa. But before you could spell Jack Robinson, digital projects are nowhere to be found. Now, let me share a very short story of two clinics in Malawi as we get started. One of the clinics received AI diagnostic tablets, fully funded, top tier tech. 2 years later, 92 of them sit unused. They were unused not because they broke, but because one showed nurse Amina how to reboot them after a power surge. Just 50 kilometers away, another clinic running a low budget telemedicine program now sees over 10,000 patients every month. One out of these two scenarios, one was built for Africa, the other was built with Africa. One was built for Africa, the other was built with Africa. Sincerely speaking, that is the difference we are here to talk about. Now, I divided my talk into sections. Let us look at the pilot paradox. Now, under this pilot paradox, the key message is that 80% of digital health projects in Africa fail after the initial funding dries up. 80% of digital health projects in Africa fail after the initial funding dry up. Why? The number one reason why these projects fail is investor myopia. Investor myopia. The money follows flashy tech. Investors will come in and they will sink in money into sexy tech like AI, blockchain, not, and they will neglect the basics like training or content. The second reason why 80% of digital health projects in Africa fail, according to my assessment, is the 18-month curse. Projects die when the foreign experts leave. In Africa, the moment the foreign experts leave the project, it will die with them because local teams weren't given real ownership from day one. And the second reason why digital projects, health projects in Africa fail is data colonialism. What I call data colonialism. It is no longer news that Africa was colonized by the Europe. And we still keep finding this element of colonialism. All of us will agree with me that a lot of data that are collected from the platform of health tech platform that we're using in Africa are being in the server outside Africa. Over 70% of our health data ends up on foreign servers. That is a huge problem. Now, let me give a human example. In Uganda, a maternal health app failed. Why? Because the developers assumed every woman had a smartphone. Even when community health workers told them, one of the community health workers said, we told them, but they didn't listen. Now, we are made to know that everything that keeps working works on principle. And the God that created heaven and earth is the God of principles and works on the platform of principle. So, in other words, everything that is working on the planet Earth are being governed by laws. Anything that keeps functioning, including our system, functions because the laws that are guiding those things, the workability of those things are still intact. The moment the laws are broken, those things will stop working. And so let's look at the 4 laws of code development that last. Number 1, let's look at what actually works. The law of reverse ownership. The law of reverse ownership. When foreigners bring in solutions, projects, I believe they should reverse the ownership after a time to make it local. That the local people, the local community should own the project if it must last. If the community can't fix it, it won't last. Well, that is my position. If the community can't fix the project, that project would not last. Life Bank trained local engineers in Nigeria, cutting through, drones downtime by 70%. Zipline in Rwanda, they made local data and skill part of the deal from the start. That is why those applications, that is why those projects are still in progress right now. Now, let me ask this question. Are we training locals to maintain what we deploy? Until locals are made to own the project, it may not last. Now, the second law we are looking at is the law of
Okay. I think Samuel is muted. Let's see.
Hello.
Sorry.
Sorry about that. Sorry about that.
All right.
That was my fault.
Okay,
Sorry.
am I still on board?
Sorry about that.
Can you go ahead?
We can hear you.
Thank you so very much. I was looking at the second law that will make things work in Africa, and that is the law of problem first, not tech first. Any project that is tech first may fail in Africa, but any project that comes with the problem, finding solution to the problem, may stand the test of time. People don't need blockchain input. They need medicine and care that works. Take, for instance, the M-TIBA in Kenya embedded health financing into M-PESA because trust already existed there. Another one is the M-Doc in Nigeria. M-Doc in Nigeria use WhatsApp voice notes for diabetic care because voice feels human. I want to remind us this. Tech should follow the problem, not the other way around. The third law that we are looking at is the law of global local infrastructure. The law of global local infrastructure. The law of local infrastructure. Operating globally, but adopt locally. There is a saying that is so common in Nigeria. We will say, think globally, but act locally. Think globally, but act locally. If you want to bring solution to the health problem in Nigeria, in Africa, then you must be able to think like we do. You must be able to think globally, but act locally. For instance, Ghana's DHIS2 system lets startup plug into national data. No need to reinvent the wheel. Liberia integrated with public health systems and saw 8 times the reach. Now, let me drive this home. If your solution can't integrate, it won't scale. Any solution that cannot integrate will not scale. Finally, the last law, the law of content first. I wouldn't know whether this is because I'm a content creator, so I'm influenced, and I know the importance of content. A lot of, thank you very much, Joss. A lot of foreigners that build apps for us, when they come, all they need from us is just the translation. They wouldn't want the real content that will meet the test of time. And if the people people don't reject tech in Africa. They reject what doesn't speak their language. People don't reject tech in Africa. They only reject what doesn't speak their language. And so any solution, any project that must stand the test of time in Africa must always have the local language, speak the street language of Nigeria. Thank you so very much. Let me just pause from there. Thank you for having me.
Yeah. That was amazing, Samuel. I feel like this is the second time I know it's delivering the same way he did his first time. Very important notes and very detailed in terms of how specific it comes to this population comes to Africans for Africa. So genuinely,
Sincerely speaking, I can't hear you at all. You're breaking.
You want to turn off your video? I'll stop your video. How about
I should
that?
turn off my video.
Oh, yeah.
Yeah.
It's better. Can we hear
It's
you?
better?
Yeah, it's better now.
Yeah, I was just pointing out how Samuel was able to make the point very direct, very specific to what Africa needs in terms of innovation and in terms of coming to terms with the fact that it will look different for us. So I really do appreciate the fact that he still carried the energy from the first webinar we had. So lovely, Samuel. Thank you so much.
Thank you. Thank you so very much. I appreciate it.
Well, we're wrapping up. We got 10 minutes left. I call this the group hug, where we bring all the speakers on the screen And Elvis, can you hear us? Elvis is here. And I think
Hey, hello, I can hear you.
we didn't really can I have a question? Ask a question.
Yeah.
Chinny, I mean, you guys have mentioned this as well. Mentioned that only 1% of the data that's being used to train AI comes from Africa. And you mentioned 80% of African. Amal, do you want to put a question in the chat, or I can bring you on in the after party? And is this something that people are looking at? Are people looking at? I know Chinny went to an event about it just before our last webinar. Is AI changing digital health in Africa? Is it something that people know, or is that just not really that important at this stage? Do you want to take that question, Collins?
Yeah, sure. Is AI, could you restate it once again so I respond in context?
Is there going to be more training? I'll actually make it more specific. Is there going to be more African data, data from Africa, going into the training of AI models? And it's a two-part question. Is AI having an impact on digital health in Africa, like it is in the United States and Europe?
Absolutely. I like how you broke down the question. So I'm going to respond to that with out of experience and actually what I'm seeing happening in Kenya. So let me start with the AI. The AI bit is in Kenya. One of my friends called Joe Karanja, shout out to him wherever he's watching. He's part of the core team that did Simba AI in Kenya. So Simba AI is another LLM in Kenya that's really working a lot of work to, similarly like what DeepSeek is doing, what OpenAI is doing, that's what Kenya has done. And so now what I'm seeing them doing is trying to integrate with local businesses and try to see how they can. And also in this essence, even on the digital health part. So talk of the impact of AI in Africa, for sure there is. The other bit is I served as the former VP of Wakili AI. That was a generative AI on low part. But coming to resemble on this other side, I am on the digital side. We really have a lot of more techies in Kenya and more techies across East Africa and Africa and the rest, trying to use AI for the impact. And how we see this AI bit coming in, it's when we see real and tangible work. And for sure, more and more businesses are even integrating. Talk of telemedicines of the hospitals I was mentioning. They're integrating to use an AI to screen the patient. Talk of the AI bit even on Mimi AI. You have a conversation with the AI to pre-screen what you're going through on mentally. And then the other bit of the question is on how we gonna make sure that apart from just the impact bit, what's about now the data? All this data that is being collected, whether you go to the hospital, how frequent do you go? Talk of now Jungo Farm with the consumer app, and even Jungo Farm B2C model, where what I've been seeing, and actually, just having the privilege to be in charge of overseeing some of this data and what we are doing here and there, what I see is with Jungo Farm, one of the things they even offer is BI, business information, information intelligence. And so this bit of AI is where we are able to predict, oh, so many people in this county in Kenya, they bought X and Y medicine. So it means maybe there's a cholera outbreak somewhere, maybe there's pneumonia somewhere. And it's because of all this data that keeps compounding. People are using the solutions we are creating for them. People are doing all this for them. Talk of even Mimi AI, what I'm doing. many people are clicking on a link on a meme that affects their mental health. And that tells you, oh, this set of individuals who are using these kinds of memes, there must be a problem. We need to start addressing it. So when we conclude and get like this sort of data, talk of even the prescriptions and how we order them, talk of other, I think there's Zuri Health, Maidawa and whatnot, all these solutions in Africa that are doing that. And one of the best examples, Jungo Farm, where we can be able to tell in Kenya, this is how flow of medicine is going. This is the number of prescription the country is serving through the data that we get. So all this data that we have can be used, and we really want to use this data in Africa, not in the US. We don't want Europe or whatsoever to come and say, hey, this is the data that we want. We want to, I see Samuel clapping. We want to say, you know what, there's talk of health issue in Africa or an outbreak of something. We can be able to pre-predict, manufacture more medicines a bit earlier, have these investments and co-developments together, so that this AI and this data we are creating is able to really be able to give us instincts even for what we are solving right now and what awaits us in the future. I think I've really gone to detail and given many examples. Yeah, back to you. I hope the question is well answered.
Thank you. That was a good answer. And I know, can I go to Antonia?
Yeah, of course.
You talk a lot about the ethics of AI and healthcare and governance. I wonder if I could ask you a different question.
Okay.
Because everyone talks about this ethical framework, this governance framework. There's so many ethical and governance frameworks. And then there's also people say, hold on a second, that's not enough. It's more complicated than that. Is there a context in Africa for Oh, sorry, we got somebody with a live mic. Sorry about that. And that's different. Is the ethical and governance context in Africa for healthcare of AI, is it different?
Yeah.
And how is it different?
Well, so Jose, the thing about when it comes to ethical frameworks is it's typically the last considered thing, whether it's AI or healthcare or just digital health in general. And I think my personal interest is because I've come to understand that when it comes to making technology for Africans, we tend to, when it comes to the ethics, it's the least considered but the most important thing at the end of the day. Personally, I would say, because I am Nigerian and I know that this webinar is featuring people from different African countries and the context might be slightly different because of different laws and whatnot. But I would say a unifying factor for all of us, regardless of where we're coming from, is that there is very little knowledge on how AI can be applied to healthcare, in particular in African countries. There's a lot of interest, but not much investment at the time. So the frameworks are very, very copy paste of what the global West is doing. So what that means for us right now is we're still at the infancy level. If I'm doing anything when it comes to helping contribute to policies or helping to be the voice to communicate, because it's AI literacy, because Africans need to understand what AI is for them to understand the need for an ethical framework. So right now, when it comes to the development of ethical frameworks, for each context for most African countries, it's non-existing. And it's mostly based on what the global West is doing, which puts us at a disadvantage, because the way I use ChatGPT will be different from someone who is the same age as me, the same gender, but lives in the US would use ChatGPT. And I think it's relevant when it comes to innovation, investment, and co-development in healthcare, especially digital health. It's very easy to do what the West is doing and get to stumble block where it's like, oh, this doesn't work for us because the average African person would not relate to it. So I say all this to say that my contributions and my perspectives and our ethical frameworks can come for every context and include everyone in the conversation right now is more tailored towards AI literacy than having a direct conversation with the government. Because the government at this point they're more occupied with trying to build economic wealth from the resources they're already familiar with. And that's why it's very important to have these beautiful conversations with brilliant minds such as our guests, because they get to open the platform, open the just the idea that we can have these conversations for Africans without having to make the global West the leaders of the conversations. Like Collins said, we don't want technology that is applying, or rather that just speaks on pitch decks, because pitch decks are typically how we would want to communicate ideas to people who are not us. But we want to be able to go to the grassroots level and let the average person know that this app exists because it's helping you. It doesn't exist to make money for another person, which is the dissonance we have when it comes to the West making technology for Africa. So I don't know if that answers your question, Jose.
Thank you. And we're not getting rid of Antonia, but we're starting the after party.
This is the end of the webinar. Don't go. Going into the second phase. And I want to thank all our speakers for participating. Thank the audience for coming. This is the end of the webinar, but it's not the end.
Yeah, looking forward to seeing everyone at the after party. It's currently late.
We're in the after party now.
Yeah, like it's a real party for us because it's nighttime in Africa.
Oh, it's nighttime for me too. I'm in Spain. So I think we're in the same time zone, Antonia.
Yeah, we are.
I think it's like over here, it's like summertime. We changed the clocks. If anybody wants to speak on camera, put your hand up, raise your hand. Amal?
I'm bringing you on camera. Amal?
Yes.
And I'm going to add, let's see, add spotlight. Feel free to speak. Can you hear us?
Yes. Can you hear me, guys?
Yes, we can hear you.
Okay. So my name is Amal. I'm the founder and CEO of a company called Vitalview AI, situated in India. So we are the company who predicted Nipah virus in Kerala 2 days back. It's a national news in India. So we are using artificial intelligence to analyze bat oncology and come with that WHO data, whatever data we could, and we predicted that. So we and Africa, India and Africa, we share an ancestral collection together, and the population, if you are comparing, we have like 1.45, and it's similar to Africa what we have. And there are diseases. We are a company. It's a public intelligence company, like public health intelligence company, what we are doing it. So we are doing a lot of things. We are doing a lot of public health, and not doing this to generate money, or we are a bootstrapped company, a very small company, but still we are able to do real-time surveillance on diseases like Ebola, diseases like Nipah is the one we are facing in Kerala. Kerala is a small state in India. So if we are getting an opportunity to collaborate with our global countries or whoever it is, we would like to do it, because our technology, we are detecting a lot of things. We are detecting Nipah. Currently, we are collaborating with defense. A lot of things are happening, and we are a public intelligence company. So I was hearing to whatever Jose was saying, and Samuel, Samuel, I also have this problem with eczema, those kinds of disease, and Katimbo and Collins were also talking about the stuffs that is going globally. So if we can also collaborate with you guys, we can make some much better impacts. So technology wise, we are doing better because I'm a software engineer, and we have been working for 10 years in artificial intelligence. So if we can
They
collaborate
are.
together, great.
Thank you, Amal.
Yes, those. Okay.
And let's see. Is anybody else would like to speak? Ask a question of our panel. And I know Mories is going to get Mories, one of our speakers, has joined, and she's going to be addressing us with a talk shortly.
I just, yeah.
Is that you, Maurice?
Oh, yes, yes, yes.
Hello. Welcome.
Thank you.
And Dr. Atoki, sorry, I should be calling you Dr. Atoki, is the head of the African Business Coalition for Health. And you joined us quite late. But you
yes, I'm sorry. You know, I spoke earlier, but I listened into the last two speakers, and I'm glad that I did. So
I'm wondering if you can give us the view from the 30th floor on the landscape of investment that you're seeing from your perspective in digital health in Africa. And if you could point out some opportunities and some challenges, and maybe give some people some advice on how to overcome them.
absolutely, yes, sir. So just give me a minute. I think generally speaking, Africa, like every other continent, is at an evolving stage as far as digital health is concerned, digital health by itself. So, and all of the nuances that surrounds it, so call it investment, call it the design itself, the concept, the science of it, and so on and so forth. That's it. May.
Hello, Maurice. I think we lost you.
Can you hear me?
Yes. Yeah, we can hear you.
Okay. So when we narrow down a little bit more to Africa, we can conclude that we are experiencing a technological awakening. I mean, that's the level at which I will put a lot of the sectoral advancement as far as tech is concerned. Now, the health landscape stands at a critical turning point, and digital health is no longer in the future. It's a present day necessity with the potential to transform healthcare, transform access, transform quality, and deliver the equity that Africa so much has looked towards across the continent. Now, if we look at the opportunity itself in terms of Africa's digital health landscape, there are quite a number of them, and I'll start with demographic dividends. So when we say demographic dividends, let's consider Africa as the world's youngest population, with a growing mobile and the internet penetration at about over 70%. That is a fertile ground for digital health innovation, without mincing words. That by itself puts us, ahead of a lot more growing populations. But are we harnessing that demographic dividend is the question. Are we really capitalizing on that youthful population that we have? That's one opportunity on the one hand. Then we look at healthcare gaps. So again, most investments critically look at where gaps are to fill Opportunities are oftentimes around where gaps are. And so there are, without doubt, healthcare gaps, fragmented service delivery, workforce shortages, weak health infrastructure. These are things that create urgent needs that technology can address. Now, another area, leapfrogging. As a continent, we have the unique opportunity to bypass legacy systems and adopt frontier health technologies. Again, mobile first models, cloud-based MRs, and so on and so forth. We can leapfrog as a continent. And that's a good advantage for us. And so the question is, I mean, for me, I'm from the private sector, the coalition of private sector, health and non-health. And we're inimical to driving digital health transformation. For us, is a lot of priority because for me, tech is the future. And I know for a lot of people, so the adoption of it seems to be slower than we would imagine on the continent. But it is inadvertently going to sharpen a lot of transformation that we're seeing now. And there's no denial for it. It's just unfortunate that, sometimes people get lethargic into the old ways of doing things and don't want to make that change as urgently as needed. Now, but when we consider the presence of the private sector and what the private sector is positioned to impact as far as this change is concerned, we're looking at private sector as an innovative engine, driving research and development, scalable models, and consumer-centric solutions. Again, private sectors are the ones that I think unique to other health systems, especially the advanced one. But we know that the public sector is responsible for public health. But in African countries, it's always about lack of funding. And so it just goes to say that the role of private sector is more endearing in low-income based countries and Africa for that matter, as far as tech is concerned. And why we say this is because private sector understands result-orientedness, understands profit making. Private sector understands how to be operational efficiency because to be operationally efficient because the sustenance of that business rides on the back of being efficient. Startups and digital health companies bring agility, lean operations, cost optimization, customer insight, tackle things like inefficiency. Because there's a very thin line between it and productivity. We also look at capital mobilization. Investors, corporate venture arms, and LTech just have the power to fund and to scale promising innovations. Now, thirdly, let's look at the current investments trend in Digital Health Africa. Again, we talked about investor interest. This seems to be growing, especially in areas like telemedicine, more diagnostics, health logistics and supply chain digitization, AI for diagnostics, and yes, there's a lot of awareness on these areas. The growth, they're not exponential. The gaps, really, and the opportunities that Africa has to absorb the level at which tech, not just the level, the solution that tech provides is almost unlimited. Another investment trend is around geographic hotspots. So again, we spoke about demographic dividend, we talked about population. When we're looking at hotspots, we're thinking about countries like Nigeria. We're looking at Egypt, very highly populated countries attracting a lot of good deals. Challenges remain short-termism, perception of regulatory risks and the reality of regulatory risk, an immature regulatory landscape, and preference for fintech over health tech investments are issues that we're still battling with on the continent. Especially, I mean, I know Nigeria for once, a lot of energy and investment charged towards fintech because it's clear. The growth pattern is clear. The dynamics are more risk averse than health tech. And so is a challenge. So until the narratives change for health tech, then investments might not meet up in the way that the needs actually present. You're saying, do I still have time?
Yes, you do, Mories.
Oh, okay. So let's talk a bit about the investment barriers for some of these private sector stakeholders. So I mentioned the absence or immature regulatory landscape or frameworks. That's a big issue. Sometimes it's either
You go a bit quiet in a couple of places, Maurice.
I'm sorry, say that again.
You go a bit quiet in a few places.
Can you hear me now?
Yeah.
Okay, so I was talking about what investment barriers there are for some of these key investments. And I talked about the regulatory frameworks. So I'd mentioned earlier that some of these regulatory standards or landscape are either completely missing or they're really, really immature. So absent or fragmented across African countries. And this just makes it difficult to bring in new ideas, to trust new ideas, to innovate technologies, to apply what has worked in some other jurisdictions, and so on and so forth. Another pointer is data governance uncertainty. It's about inconsistent enforcement of data protection laws. This also is a deterring factor as far as long-term investment is concerned, especially in areas that other countries have advanced. If there is uncertainty or non-clarity about the data governance rules or laws, then it will no doubt slow down long-term investment. Of course, we have the issues of health insurance that is not as popular as you have it in advanced environments, which limits consumers' ability to pay for private digital health services. So insurance, we still have not completely won over the model of health insurance in Africa across board. So even in Nigeria, I mean, there's been growth, but it's not as grounded as you will think that a country that has gone this far at this age and time would implement. And the last one for me in terms of these barriers for investment will be health system integration. Digital tools often exist in silos. There isn't deliberate integration into broader health infrastructure. So it's almost as if most of the apex government in African countries lack either the appetite or the urgency that is required to adopt most of these digital tools holistically. And so what you see is that they are also in fragments. They are they are taken with one eye open. They are adopted without integration. Sometimes it's a pilot or a test, and it's never fully implemented. And it's because of the divide of the demography. There's a complete generation who has refused to learn how digital tools work. I prefer the monologue and the very old ways of doing things. Unfortunate, but it is. And maybe we just leave it there. Say
Thank you.
now.
Thank you for that. I learn a lot every time I talk to you, Maurice.
It's so warm of you to say that. Thank you, you say.
And it's interesting also to see the contrast, because you just said that the lack of regulatory frameworks is a barrier to investment. And then there's people saying, oh, well, Europe, we've got too many regulations. And it's a barrier. It's making things difficult. But that reminds me, it's like if there's not enough regulation or not the right kind of regulations, is it because it creates uncertainty? Or is there another reason why it becomes a barrier? Are you still there?
I think it's a combination of things you're saying. I think sometimes I don't think it's deliberate. I think it's just really a lazy way of doing things. I believe strongly that because the systems have really, over time, gotten used to the analog ways of doing things without, digitization. And so, change by itself is usually unwelcome, except you're really decisive about it at a systemic level, as an institutional level. But when that apex governing body is not by itself certain of the adoption of digitalization, or does not put the right tools in place to effect the digitalization, the scale of the digitalization that that particular institution requires, then you can't really enforce the regulatory landscape to follow, the rightful order, because they are not, they cannot exist independently. They are a function of other systems that needs to work in the way that you want, digitalization to occur. And that, I think, is missing in a lot of African governance bodies. We're still grappling with it. So for instance, in most government, like Nigeria, for instance, you will see one or two ministries that are responsible for digitalization, for artificial intelligence, and so on and so forth. One ministry in about maybe 35 other ministries. And so it's only as much as and so it's just like what it just becomes like one of those. What I think should happen is that every ministry will have a whatever, maybe a sub ministry or whatever, that is digitally enabled, digitally driven, that the existence of that ministry is anchored upon, so that you know that it's not just one ministry doing its own thing. Because you see, ministers have the same power. And so the minister for tech, for instance, is almost equal to the minister for health. So how much of rules or authority does he have over the sectoral ministers? You understand what I mean? But if, for instance, from the presidential level, that's the apex government, the structure is designed in such a way that there's digitalization across interministerial operations, across board. So it's not one ministry, it's every ministry having a segment of tech, of AI, and so on and so forth. Then it becomes realistic. It becomes a must. It becomes mandatory that the regulatory bodies have to fall in order. They have to make it work, and so on. And so you understand what I'm saying? And until we get to that level of seriousness, it's still a lot of, seems to me like child's play. I mean, I hate to undermine a lot of work being done, because I know those ministries are also putting in a lot of effort, but it's just never going to be enough. The silo mentality from the apex government, in the way that it is designed, it's just not going to work. See, tech is like a new language. It's like the way that English became official language in Africa. And so tech is the new official language. And until you realize that it's the future and integrate it deliberately to every, to use the word freaking, every bit of system deliberately, then we will be slow at implementing things. Over, you say, I hope I didn't take too much of your time.
Thank you. That was beautiful. And
I'm bringing on Elvis.
Yeah, thank you, Jose, for that wonderful opportunity. My question actually it goes to Mories Atoki. You've talked about so many things, but my question is in terms of the private sector and public sector. How do you bridge in this divide? Because there's a big divide in terms of who should fund what. Because you look at most of these projects, yes, the government is the one owning them, but they don't have the capacity to implement what they have the power, but they don't have the capacity to implement. You find private sector is the one to implement major of these projects. So how do you bring in these two protagonists together? And then you talked about Africa having a big population in terms of the youth, which is the capital, actually the big muscle for Africa. How do you make sure that the dynamics in terms of demographics of these youth, who majority of them you find them crossing to Europe, they get trained in Europe, they get stuck there. Majority of them who can revolutionize the continent of Africa, but they don't have that capacity in terms of the financial muscle to change things around. The government has still the power, but the private sector is limited in terms of what they can do because of policy regulation. How do you bridge this gap?
All right, thank you so much, Elvis. Jose, is it okay to go ahead?
yes, that question's for you, Maurice.
Okay, brilliant. And you said thank you so much. I mean, it means that you were actually paying attention. I like that. So this is what I think about the divide, and you see, the divide has gone on for so long that it's almost hypocritical for us to deny the depth of its reality. And so for me, this is what it is. And I'm a big advocate for public-private partnership. Not because we like each other, talking public and private, but because it's almost because the advancement of anything in Africa seems to depend largely on the reality of what public-private partnership can achieve if we agree to partner. And so Elvis, for me, when two potential partners exist, one of the things I know is critical is even when they don't like each other, they recognize what each other's strengths are and weaknesses when it's business. So we must learn. So our private sector, one of the things we push for, and I'm a big voice there, is for private sector to calm bloody down and begin to rethink about what public sector has to offer. So over time, it's been about private sector. We like to.
Oh, we lost you there, Maurice.
She has muted herself.
Sorry, I picked the call. And so where I'm going is that private sector needs to accept, especially not because of our own, self, because again, an average private sector person wants his business to thrive. And it really ends there. Once, the economy favors me and things are going politically well and my business is doing well, then it's almost okay. I can be fine. But what about the rest of the nation, or the rest of the community, and every other social determinant that impacts directly or indirectly on that business? Sometimes it's not as obvious on the way that we impact. And so for me, is that private sector needs to aspire to do more with government. Two things will happen. We will force government to grow. You see, all of those things that they lazily don't want to do and they get away with, not wanting to be computer literate, to just sit behind the desk and still write and pile files and all of that. With private sector intervention and interactions, that will be forced to change, because there will be some level, it might be slow, but there will be level of influence. And so it has to be, the apex government needs, for instance, to accept this as a change in structure, to give more room and give an enabling policy ground for public-private partnerships to happen. Like I started, I'm from private sector, and I'm saying private sector needs to really calm down and aspire for this to happen. I don't think that, public sector is there to come and take away their money and all of that. Yes, they will take away your money, but you also have money to earn. So there must be an agreement, a formula to agree on. They are bringing footprint, they're bringing demand, you are bringing the technical expertise, but there will be a handshake. And through that handshake and through that integration, there'll be transfer of knowledge, there'll be influence of sectoral growth, and so on and so forth. Elvis, I hope I managed to address some parts of your first question.
Yeah, you actually nailed it, but because that's where the problem has been. Part of the funding problems is because of this competition with the private public. And you find public has many of the majority. The demographic is with the public, but your private is because of business. But you've nailed it. Another aspect that maybe I just want, not a question, just to address, is that the demographics, and the previous speakers have said, the demographics of Africa, you find the epidemiological aspect, the political control being done from the West, not understanding the dynamics of the population of Africa is what the problem is. So before any implementation of a major project, come to the ground, know the problem, understand the problem, not using quality controls from the West. Because if you use quality control from the West, you miss the point. On the actual ground, the dynamics are totally different. On the ground, you'll find you don't start up with the technology, you start up with the problem. As Samuel said earlier on, understand the nature and the dynamics of the population, which are actually on the ground level. When you understand the population, what they are suffering, then develop a technology based on the problem that is existing, not rubber stamp or copy paste what is already done in the West, because you'll find these social demographics are very different. In the West, the problems that are in Africa are not there. So when you copy paste the technology that happens in Africa, you miss the point. But when you come on the ground, you understand the challenges that are there are far much different, then you'll be able to develop a code that is in resonation with the people on the ground. It's not just developing a code for the sake of technology. It's actually the human factor should not miss in every innovation. The human factor is the key, because you want to go to, for example, a place in Kenya, in Turkana, northeastern part where it is dry area, then you come up with this silicon valley technology. it cannot work there because the people there are totally facing different challenges. That's why Samuel said, understand the problem if you want to initiate any dynamic project that you want to succeed. And then the aspect of research, and I insist on that one, the aspect of research should carry along the locals. Because if you are carrying out a research and you are doing generalization, you will miss the point. There are nitty-gritties on the ground that you will not understand unless you bring in this framework of the people on the ground. Once they tell you this is their problem, then you develop a code that is in resonance. Otherwise, you will be doing what we call cognitive disorder. You will not get the point. At the same time, technologies that have been invested in more in Africa are geared towards business. It is not more to do with problem solving. This is to do with the business. There's this fussy thing about showcasing what Africa can do in Africa, but on the real ground, the key problem that is on the ground is not being solved. So it is possible, and as Mories has said, actually the population in Africa currently, it is advantageous because we don't have old people. We have young people, majority of young people are in Africa, and they are tech savvy. These are the people you tap into that talent, and then they'll be able to drive whatever agenda you have, whether it is developing a code that is in tandem with the realities on the ground. So my take is to bring in local people, bring in local homegrown solutions for any technology or innovation that you want to invest. Thank you.
Thank you, Elvis. So something you just said reminds me of something I heard last year. Kofi Annan, not that Kofi Annan, it's a different Kofi Annan.
Yeah.
I can live in the United States now.
Yeah.
And he told me something. One of the most powerful things I heard last year is technology isn't a differentiator anymore. It's disappearing.
Yeah.
Everybody has access. Everyone's getting access to new technology.
Yeah.
What matters is your understanding of the problem that you're solving.
Yeah.
It's better than anyone else's.
Yeah.
The humanity to that and engage with that community.
Yeah.
When I met Joseph last year, he was one of the first people that was taking that community approach. Now I'm meeting 60-year-old out there now, and they're doing that. They're building the community, and they're like, so it's coming everywhere. And
that's not really a question.
Yeah.
Or a comment.
Yeah.
And I don't know if Amal's still in the chat. Amal, do you want to make another comment or a question? I know I brought you on for about 2 minutes, and then I cut you off. But you're welcome back on. I think, and I hear it a lot, is Asia and Africa coming together?
Yeah.
Amal's question in the chat.
And also something Mories said
about capital flows. I think we're going to see, I'm not going to get political, but sometimes you have to mention politics when you talk about healthcare. Is one of the reasons why you see so much technology coming from the United States. Americans say it's because we're the best. There's actually another reason. It's because Europe sends the United States 500 billion a year in investment. And a lot of that money goes into the startups. Europe has stopped doing that. Europe is not happy with the United States collectively. So now that investment money is going into other places. Same thing with China and the Middle East. So the investment landscape around the whole world is changing very dramatically, like 500 billion here, 100 billion there. The way the money's moving around is changing. I don't have a prediction, but what I can say with confidence is the flow of capital around the world is changing very dramatically.
Emmanuel, did you want to sorry, that was a comment, not a question. I hope that was useful. Emmanuel, do you want to speak?
Also, playing music, it's good music, but
going to mute you, Philip. We like your music, but we're not here for that.
Okay. Hi, this is Emmanuel. Thank you. It's been a rather interesting conversation. I do want to applaud Elvis for the things that he outlined, the importance of things on the ground. The realities are rather difficult to fathom and very challenging. It's not technology alone. The workforce issues are significant. The doctors, nurses, ancillary providers, the technology is almost irrelevant unless AI replaces those types of personnel to some degree. When you look at the life expectancy, for example, in Nigeria, as an example, where from 2020 to 2025, the life expectancy went from 46 to 56 years of age. And in Africa as a whole, the life expectancy is about 64 years. You realize the depth of the problems that have to be addressed. So whether the ministers do something with each other or not may not matter unless you establish the educational institutions to train new doctors and health providers in the country. And so, you know, as a company, we had been anticipating going to Nigeria, as an example, about 2.5 years ago. In fact, we even incorporated there. But the challenges are serious for any company to go in, not because of any cultural issue, which exists, and you have to respect working with a different culture with different set of rules. But even within the country itself, challenges are pretty serious for the people who live there. And so when you get on the ground level, the amount of healthcare available is really seriously lacking. And those have to be addressed by, with, more providers within the country itself. The other alternative, additive alternative, is certainly trying to provide remote care from other countries around Africa to provide remote care, but that's limited as well. So I do think it's going to take a combination of public and private, as was cited earlier. And also, the societal things have to be addressed before you make any headway with any serious digitization. I do appreciate what Maurice was saying in terms of the opportunities are there, certainly, to think of new things and new ways of doing, because it's not as embedded as in the Western countries and refractive to change as much, where healthcare is much more needed in terms of effective change in some of these other countries in Africa. And so I do think that it's a difficult problem. I think digital healthcare will help. It will not solve the problem alone. And I think it has to be a combination of things that happen on the ground, and as well as, digital solutions there. And so, as someone had said in the chat earlier, dropping solutions from a helicopter is not going to work, And as Maurice indicated, you have to build out the technical infrastructures to provide the capabilities for even digital solutions to work. And so you need a combination of things. And my hope is that there's a concerted strategic effort on the part of all the countries in Africa to actually work together to set out, 5, 10-year, 15-year plans to look at these different levels of focusing and having moonshot projects to do that, to build up the infrastructure, to increase the healthcare trainings, to provide, to increase the number of providers and the level of cooperation working together with other countries around them. So thank you very much for this opportunity.
Thank you.
You are actually very right, Emmanuel, in terms of deployment of technology. You find, for example, if we talk about oncology sphere, you find in Africa and in the United States, maybe they have a technology, a machine for radiotherapy, radiation therapy, that is shelf life. You have to change the software after 2 years or 3. But in Africa, you can't keep on changing the software after 2 years. You need some span, like 10 years, or before you change over. But in the United States, you can do that. You can change the software after a year. You think it is now outdated, come up with new. In Africa, you cannot do that. So we have to look at shelf life in Africa with different approach that we increase the shelf life in Africa, because accessibility and affordability, they go hand in hand. When you change the technology, you will change, of course, the pricing of everything that you're doing. But now, when you come to Africa, affordability will miss, and you will limit so many people to trying to access the very thing you are trying to change in the society. So that's the approach. And thank you very much for that.
I also think we should have a conversation on democratizing access to health in Africa, be it digital or informal. I mean, just the other day on my way going to home, some weeks ago, this is like 6, 7 weeks ago, I was going home. I met this accident that was. Oh, yeah. So I just okay. I see. Just say you. So can you see me? Yeah. We need to have a conversation around a user case that I saw out of hand. Anyway, never finished med school, but I'm serving in different other school. So recently, this is like 8 weeks ago, I was heading home and I met an accident on my way on traffic, and I met normal Kenyans. Kenyans, we are said we like our phones a lot and we always recording on Twitter. I meet these guys taking videos of the guy who was being knocked. And I was like, you guys stop taking videos, move away. I went to the pharmacy there, took my gloves, came and assessed this person, just as another assessed health person who would have done same thing, but from the background of first aid and everything, I was like, why not? So I disperse everyone is taking me videos and whatnot. And the ambulance takes close to 30 or 45 minutes on its way coming from Nairobi, that's the capital city of Nairobi, to where we were. And we go to the hospital. I take this person to the hospital, the nearest hospital. The very little was to be done. We go to the hospital, and this guy ends up, losing his life because of some reckless medical service or rather care. I mean, we went with the patient all the way to the hospital, and he still lost his life. And I was like, I really fought so hard for him. Could we have a conversation about democratizing access to digital health, to health even in Africa, leave alone even the digital aspect of it? How many responders do we have for ambulance when such an emergency happens? When we call to the hospital, how aware are they that someone is coming? I could not even believe, and I shared out there on my status telling people what happened, and people were just expressing their frustration to this hospital. And I'm like, you mean this is the biggest hospital we have in my county and people are losing lives? And I couldn't even help it. And imagine the sad news of coming and telling these fellow Kenyans here, hey, we lost a guy because of X and Y. It really felt so bad. So we really need to have a conversation about these things. It's not the first time a patient is being rushed to the hospital or an ambulance was called. Do we have infrastructure? Do we have technology? How ready are the doctors? Leave alone just building the technology. Are we even having more African manufacturers, more distributors for medicine? How much time does it take for a medicine to reach to the hospitals or even to you? And I mean, also trying to, and not even marketing, trying to look from a jungle farm lens. I think what they are doing to try and cover this thing. I even talked to Farmer Hoping. The other day I was not feeling well, and I had to go to like closely to 3 pharmacies to look for a medicine. What digital health Africa are we talking about when we can't even have these solutions at hand? I've been a victim of everything. Talk of I saw someone on LinkedIn saying some of the best founders in the digital health sector are people who have had these problems inside. The other was last week I was in the NCD Alliance. We were talking about how access to medicine is also becoming problem for those people with with medical conditions for a lifetime, lifestyle diseases or what you call them not. So if even the older generation is also really struggling to get access to better healthcare, then I think this is that time where investors need to have a conversation again with themselves and ask themselves, what are we co-building? What are we investing? And I think my closing remarks on in all this, if you are an investor, invest beyond the obvious. The next unicorn is to be diagnosis tool built by a 20-year-old boy, maybe in Tanzania or Mozambique or whatnot. If you're a policymaker, create space for experimentation and scale. Don't let the bureaucracy kill innovation. We have a lot of young people coming and, talk of like the solution I have. I met another founder who was creating ice in cases of emergency. That would be such a good solution to have solved and maybe saved the life of that guy. If you're a healthcare worker or a founder, please build it with others. Come even to us where we are the digital survey people. I mean, some of us tried med and we noticed this is not our calling. We better serve in other capacities. I look back when I see some of the works I'm doing with right now. I'm running some projects with some hospitals here and there in Kenya. And I'm like, wow, even if I'm not sitting there to inject, I'm sitting there to make sure that people are getting access to better care. Even the policymaker in my country, they, talk of our shy and chief and whatnot. And, the same thing you're mentioning, politics and our president promising us chapatis and us making memes out of them and trending the whole day, instead of having solid conversation of what's the universal health care. I interact with UHCs in Kenya and do a lot of camps with them and medical camps with them. What more health Africa are we looking for when we can do this? So let's stop flying in high-tech funding outside. Let's start planting seeds inside our own systems. And like I said, Africa doesn't need a digital Silicon Valley slide. Investments plus co-development equals real transformation in Africa. Not just technology, but equity, dignity, and access. It's really hard to be in Africa when, I think we were just making a funny meme referencing back to Mimi AI, and it was trending in Kenya. We were talking about how people are just mocking the kind of the policymaker who has been appointed there, and he doesn't even have a good background in medical side. And we were just making memes saying, you fail to watch after your health and what you're eating. Just remember that the SHA, social health authority thing that covers, it's not working. Imagine if people are making memes and conversations around this topic. That tells you for sure we have a very big problem, because it's very hard to even criticize these policymakers. They just want to sit there, with their ties, flaunt and do everything, but not have a conversation around it. What laws are we making as Africa? Is it waiting for what USAID and WHO will do? The former president talked about the same thing. What is it that Africa is doing that now Trump has said we are not going to fund you? What more strategies do we need? How many more boot camps do we need? How many more women should be giving birth in the forest when we can have even immobility, hospitals? There's so much. It's just not having webinars and conferences. And by the way, one of the things I always advocate for whenever I go for a conference, like the previous ones, and African Disability last year, I told the panel and everyone else, we're going to make a WhatsApp group. Next time when we are coming back, we're going to say, hey, we talked about this. And next time when we come for this conference, whether it's Alzheimer or Africa Disability or Med Expos, we are going to be showcasing what have we done, what were the problems we saw, and what are the solutions we did. I mean, myself, I never wished to be a founder. It's very easy to be an employee, but now you look at the problems you have and you think, I can do something. I have a background in this. So even for for Mr. Gracia and Emmanuel and the rest who are in this conversation, could we have a conversation of, yeah, this is what you're building. The next webinar series is, what are you doing? What problems are you solving? Let's talk of the problem and the solution. Not, Africa needs help. Oh, Africa, we're going to do. I mean, then we're going to be making stories here, burn the midnight oil, and we are not doing anything. Let's look for this innovative young 23, 27, 30, 40-year-olds, and let's give them support. Let's do something. That's what we call real solutions. And by the way, out of the conferences, I challenge them, I meet them, I ask them, hey, we agreed you're gonna do this. What are you doing? We chat on the WhatsApp. I follow up. Do you have a meeting that we can have a conversation? Do you need my help? I want to help you do that. I'm a real guy who really wants to do solutions and not just give stories. Every day when you meet these people, I mean, the other time I met some organization that supports women, and I was like, the lady would not just afford $40 to only get her medicines. And I said, could you take her to the hospital? I'm going to pay her bill. What more infrastructure do we need? And, she lives to say thank you and gratefully, telling me many thank yous. But I'm like, only $40 to access quality affordable care, and this is health, would have a system where it's helping all these things. Africa doesn't need to be helped. Africa needs solutions that are tangible. We need more African investors who are coming here to do solid work. If tomorrow a young guy is coming and saying, this is what I'm doing, this is the problem, and we can validate and not start telling them of how the idea is not working. The other time I was in some startup series, and I remember the challenge, and one of these guys was telling me, Kijana, you are mad. That's saying, young man, you are mad. Stop building many things. Now, when they see the real traction, they're like, oh, this guy was doing something. When we are taking much of our days, even at Jungo Farm, walking from one pharmacy to the next, getting outside the capital city, going to the outskirts, going and meeting these pharmacies, meeting these individuals, people in the remote side. That's the digital health Africa we want. It's not about sitting in the office, rolling on the seats and doing everything. We want a digital health Africa that even the 50-year-old three mama in the village, your old mzee in the village who is also trying to look for his diabetics medicine, they can get real solid health. So it's very, very, I'm very passionate about digital health in Africa, and I'm very passionate about what it is. We don't want more helicopters coming to drop, medicine, because even the Ebolas, the COVIDs, and all these big diseases of the world would have AIs that are helping us, or digital solutions that are helping us to be able to really, really foresee this. That's the same things I'm doing on my own capacity. I'm partnering with hospitals left, right, and center in Kenya, trying to help the doctors meet more patients, ask them to even give them subsidized rates for them to charge them, or sort of like, pay them, pay the doctor and put them in a payment platform. The other day, I was talking with Kenya Association of this terminal illness, and we were like, even medical insurance cover, they don't want to cover some insurances. Why? Are we profiting over health? That's the worst thing ever to be doing. And I think one of the things that even Africans need to have, even us as founders collective, we need to come and have this real conversation. And this is what Mr. Gracia is doing here. This is the conversations we really need to be having and be able to put Africa to the next level. And if we do this, I'm telling you that the other time, Jose, if you want to come to Kenya, I send you an invite. I'm going to be taking you, showing you, these are the patients we've helped. These are the organizations. These are the non-communicable disease associations. These are the women for dementia. This is what Hamat is doing to solve its community. This is what I'm partnering with banks and other small NGOs to make access to healthcare to everyone. I mean, sometimes when we look at founders, we tend to judge them by age and saying, that idea ain't working. You know, startups are built by people who have had these solutions. If you are struggling to, I mean, even myself as a techie person, I'm struggling to working 1 or 2 hospitals to get medical help. I mean, we really need to wake up Africa. Those are my remarks on that. And I really want to have this more of this conversation and more of, let's do the next webinar series of conversations around what you've done and what problems you solved.
That's a use case events. I do them. They're more work. I can't do them by myself. And use cases events, they require more preparation. They're worth it, but it's not just like pushing a button and it happens. Whereas this is very easy to organize, set it up, boom, we're talking. If you actually want, for the event, kind of event you're talking about, I wouldn't be able to do it by myself. I would need help. I'm happy to talk to you about that, Collins.
Absolutely.
Yeah. We're a little bit over time. Samuel, are you there? We're over time.
Yes, I am.
Can you?
All right, I know.
Can you very quickly, Samuel?
It may not take us up to 2 minutes. I just want to express my sincere appreciation to you and your co-host. I want to thank Dr. Mories for that insightful conversation that she brought to the table, and Emmanuel. Sincerely speaking, I want to make a passionate appeal to the investors in the house and those that will hear this recording later. Yes, return on investment is good, but how about return on partnership? Yes, return on investment matters, but in a health system, what lasts, what scales is built on trust, not speed. Example, systems that are co-designed, systems that are co-owned, systems that may grow slower, but they last longer and open new markets. So my passionate appeal is that we should look at the return on partnership. We should co-own system projects, and we should partner to make Africa great. Thank you so very much, Jose, for this opportunity.
Thank you.
Bye from
do this again. And Collins, maybe we can have a chat.
Absolutely, yeah, absolutely.
I actually do want to do the event that you're talking about, but there's more preparation and there's more organization to make that happen.
Absolutely. So I think, like I've stated, this is a very passionate conversation to have around Africa. I saw some guy from India, people from all these things. And by the way, don't get it wrong. It's not that we are fighting the West, and we are just saying some solutions.
That's right.
Just need some solutions just need the right fork. You know, maybe in the West you use 2 forks, in Africa maybe you're using a spoon. So we just want to have a conversation around what is it that's happening and what's Africa doing the next big thing. So if we can do that, we are telling the West, the East, and North and South, hey, we have a unique set of challenges. When you have this conversation, then it means clearly as Africa, we are going to do so. And even to talk of partnerships, co-developments, and also the investments, we really want to have more VCs, more funding coming this direction, at least even more accelerator programs for these telemedicine and telehealth startups. be coached by, individuals who have done this before, help them be able to be on feet. It would be very, very happy if my country has like 40 something counties. If in every county we even had digital solutions around that on health, it means would have a very healthy Kenya, would have a very healthy Africa, would have very big solutions around who is manufacturing. If you're an investor, does it mean you're just coming to push the tech only, or even the when Africa wanted to do its own plant on medical supplies, we've had a lot of politics. So can we revisit this conversation in a different lens and have young people with ideas come and work with senior people with experience and expertise, and do an intergenerational mingling and be able to do something? I think those are very passionate remarks on my end. I would be very much open to have a conversation on the same note and talk about these things in terms of what we can do and what's happening. And let's do conversations about what has been done and where we need to be at. Thank you, Jose.
Thank you. I want to thank everybody for coming. And there's going to be another event. We're going to announce it a bit later. And Antonia is creating the theme, and I'm going to consult with the other speakers about the topic, the subject matter, and scheduling. And I like your idea, Collins. If you're willing to help me, I will do it. We'll do it together.
I'm very much open to helping you do this.
Thank you very much, everybody, for coming. We are out of time. Everyone have a great night. Take care.
Thank you. Thank you. Thank you so very much.
Thank you, Jose.
Thank you.
So,
Thank you, Samuel.
Is
Thank you,
Dr.
Jose.
Mori, is Dr. Mori on the WhatsApp?
Thank you, Colin.
Thank you, Dr. Mories.
She's still here.
Okay. I actually wanted to ask her to, just text me and let's talk. The after party was nice.
That's her laughing. Take care, everybody. Good night.
Thank you. Thank you, Jose. Thank you, everybody.